Do you have downturned corners of the mouth, aka a permanent frown? Well, if you do, then this segment will hopefully help give you some great options for treatment of it. Some people call this BRF, bitchy resting face. Excuse my language. That was something that's been made popular on social media, and there was even a television segment on the Today Show talking about it. How some of us, no matter what we do, if we're just at rest with our face, it makes us look grumpy. And typically it's due to the downturned corners of our mouth. And in my family, my dad's side of the family, it kind of runs in the family. My grandfather and my father both have the really downturned corners of the mouth. And I can see myself developing a little bit as I get older. So I'm going to show you something that most people don't see. I'm going to relax my mouth and you can see just what I have. So you can see I have a little bit of the downturned corner of my mouth, and so something that I'm going to need to tackle. And if you're watching this, then we have this in common that I'll need to tackle as time goes on. All right, so let's talk a little bit about these downturned corners of the mouth. Once again, it's known as a permanent frown. It's when the corners of the mouth droop with time and with age, and there are a number of reasons why this can happen. Gravity kind of pulls our face down as we get older, and that kind of pulling effect of our face down will help also pull the corners of our mouth down with it. And that's one reason why we develop jowls as we get older. Second thing is sometimes we can get overactive muscles down here. And there's a muscle called the depressor anguli oris, which is a muscle that comes from your chin up to the corner of your mouth here. And when that muscle is overactive, it can kind of pull that down. So I'll show you how that muscle works here. So by doing that, I am basically using that DAO, depressor anguli oris muscle, to pull the corners of the mouth down. And some people, that muscle is a bit overactive and creates that appearance. So typically it's a combination of gravity with sometimes genetics, and that we just have a certain shape that we inherit from our parents, along with that depressor anguli oris muscle that pulls it down as well. Okay, so how do you treat it? Well, the first way and the easiest thing you can do is inject some Botox into that depressor anguli oris. And that will then weaken the muscle that pulls the corners of the mouth down. And if you're not sure if it works for you, just try to frown, do a big frown, and look in the mirror. And if you can see, in general, that muscle pulling the corners of the mouth down, you'll see that that's what it's doing. Okay, so injecting a little bit of Botox right here and here can help to counteract that muscle. And it doesn't need a lot of Botox, literally anywhere from 2 to 2.5 units is all we inject on each side. One little poke here, one little poke here. You give it a week, and all of a sudden the corners of the mouth lift up a bit. The results last for about 3 to 4 months, after which case you do need to repeat it. If you stop doing it, then the DAO muscle just comes right back. But this is the first step. If you've got the downturned corners of the mouth, if you feel like you have a permanent frown, start with a little Botox there, because that may be all you really need, which is less expensive than the other options, okay, and much easier to undergo. Well, if that doesn't do it all the way, then the next step is to use an injectable filler. In my office at YPS, we recommend hyaluronic acid fillers, starting with Juvederm Ultra or Ultra Plus, Restylane Refine and Define, as well as Restylane and Restylane Silk. And you know, all of these types of hyaluronic acid fillers can definitely work for the corners of the mouth. It just depends on how severe they are. So for example, if the corners of the mouth here aren't that bad, then maybe a little Define or Restylane Silk is all you'd really need to pull it up. If, however, you've got really defined corners of the mouth, they're really coming down, then using something a bit firmer like the Juvederm Ultra Plus might be a bit better for you. Now, all of these last anywhere in longevity from about 6 months up to a year or so, sometimes a little bit longer. And so first step would be the Botox. If the Botox doesn't do it, then usually one syringe is all you need of the filler to try to inject right kind of along that marionette line and under the corner of the mouth to try to lift it. And some people benefit from then a combination of both, the Botox with the filler. Filler injections are really easy to undergo. They'll take about 15 minutes to perform it in the office. You may get a little bit of bruising afterwards. Typically for this area, most of the time we don't use a cannula. We use a needle just because we want to really get in there and get into the dermis, the deeper skin, to kind of get that dermis to thicken and to kind of push the corner of the mouth up. Okay, so most of the time we're using needles, although a cannula sometimes could be used depending on the patient. As far as the Downtime recovery, very minimal. You may have a little bruising for a few days. That's about it. If you feel any lumpiness, you kind of press on it, and that can usually help settle all of that out. Now, the risks of the filler, sometimes it can feel like it's a little bit firm in that area, which may not feel completely natural. It can give a little bit of a stiffer appearance, potentially. The Restylane Refine and Define are meant to decrease or to minimize any stiff appearance. And so if that's a concern of yours, kind of a stiff look here, then using the Refine and Define may be a better option for you. There's always risks of bruising and infection, although very, very low risk with these types of injectables. And obviously they do wear off, and so at some point you have to redo it again. Well, if a filler doesn't do it and the Botox doesn't do it, then the next step is a corner mouth lift or a grin lift. Now, this is a surgical procedure where when the lips are really droopy, I can literally cut a triangle of skin out from above each corner of the mouth, suture it back together, and by suturing it together, I can suture the corner of the mouth into a higher position. And this can be very, very effective in people. The negative about this, however, is it does create a permanent scar. And that scar typically extends from the corner of the mouth up towards your nasolabial fold on each side. And this does not match the natural wrinkles of the mouth, and so this scar can definitely be visible in some people. Because of that, I only recommend the grin lift or the corner mouth lift in patients who are really over the age of about 60. They tend to scar a bit nicer, and people who are younger, if you, let's say you want to have this done and you're 40 years old, I don't know, that scar can be quite visible, and people who are in general in their 20s, 30s, and 40s don't heal with as nice as scars as people who are in their 60s, 70s, and 80s. Okay, and so typically I say this for people who are a bit older, where the collagen in their skin isn't quite as reactive and quite as thick. They tend to scar this better and get a better result. The other thing I'd let you know is I tend to do this typically if you're a candidate for a grin lift, usually you'll necessitate two. Okay, instead of removing the more skin that I remove, basically, the more of a lift I can get, but the longer the scar afterwards. And instead of doing one huge corner mouth lift, giving a big long scar, I would prefer to do two smaller ones to give a shorter scar in the end. Okay, and that's something that we can talk about in a face-to-face consultation if you decide to have this done. Now, a corner mouth lift can be done in the office. It typically takes about 45 minutes or so, just done under a local anesthetic, where I literally just cut a triangle out from above each corner of the mouth and put some sutures in. Those sutures stay in for about a week, and they will be visible for a week, and so people might look at you funny, so for a week you probably want to hide out. We take those sutures out after a week, and it usually heals just fine afterwards. Now, I'll tell you, a grin lift is great for the downturned corners of the mouth, but it won't treat a marionette line. So if you've got a line coming down here, a grin lift won't get rid of it. It will just lift the corner of the mouth, and so that line you want to treat using an injectable filler. And the best results are somebody then who uses all three of these treatments: the Botox, the filler, followed by the grin lift. And that usually does it for people. The only group it doesn't do it for, however, are people who have a lot of looseness down here and things are really pulling down. In those patients, if all you do is a grin lift and some injections and the jowls are pulling the corners of the mouth down, it's usually not enough. You have to add a facelift to it, believe it or not. So this is an example of a patient you can see really downturned corners of the mouth in those marionette lines, especially on the left, on your left. On the before picture, she used to get food particles stuck in that marionette line. It was so deep. So for her, I performed a lower facelift, and that helps to lift all the jowls that are pulling the corners of the mouth down. Combine that with a grin lift and some filler, and you can see the mouth looking so much better afterwards. This patient did not have a lot of looseness. She did not have big jowls or anything, so I was able to lift her up with just two moderate grin lifts. Okay, and she healed very, very well. Once again, a little bit of an older patient, but really did well to really shape the corners of the mouth. She does have a little scar coming up here. Because we did two of the moderate grin lifts, she doesn't have the big long scar coming up much higher. And she did not need a facelift. Well, this is a patient who actually had a facelift by a different doctor, but he didn't do a grin lift. And you can see on her before picture, I apologize, it's a little overexposed, but you can see how the corners of the mouth are really drooping, and she looks quite angry. Well, it's the grumpy look that we want to reverse. And so for her, she already had her lift done, her facelift, so she didn't have jowls and all this skin and fat pulling her corners of the mouth down. This is just what she had after the facelift. So what I did was I did a series of 2 Grin lifts to lift those corners up to kind of finish the job for her. And you could see a really nice improvement there. Once again, the permanent scar coming up from the corners of the mouth. So if you've got downturned corners of the mouth, if people say, hey, you've got a permanent frown, start with the Botox, the DAO, and then follow that up with the injections of filler, and sometimes we'll do that at the same time. If that doesn't do it, then the Grin lift is the next option. So I hope this was helpful for you in your quest to turn that permanent frown upside down.